ICD 10 cm Practice Questions and Answers Chapter 1, 30 Critical Questions. Question 1. What is the correct ICD 10 cm code for typhoid fever? A02.0, A01.0, A01.1, A00.9. Code A01.0 is for typhoid fever. Question 2. A patient has pulmonary tuberculosis. The correct code is A15.0, A16.0, A15.4, A16.4. A15.0 represents tuberculosis of lung, confirmed by sputum microscopy. Question 3. Which code represents Zika virus disease? A92.8, A92.5, A92.9, A93.0. A92.5 is the specific code for Zika virus disease. Question 4. A patient is diagnosed with Lyme disease. The correct code is A69.21, A69.20, A69.22, A69.29. A69.20 is the code for Lyme disease, unspecified. Question 5. ICD 10 cm Chapter 1 covers which range of codes? A00B99, C00D49, E00E89, M00M99. Chapter 1, Certain Infectious and Parasitic Diseases, spans A00 to B99. Question 6. What is the default code for sepsis, unspecified organism? A41.9, R65.20, A40.0, B37.7. A41.9 is the code for sepsis, unspecified organism. Question 7. When coding HIV, what does code B20 represent? Asymptomatic HIV, HIV exposure, HIV disease, symptomatic/AIDS, inconclusive HIV test. B20 is used for patients with known symptomatic HIV or AIDS-related conditions. Question 8. A patient has COVID-19. The code U07.1 should be used only if confirmed by lab test, if suspected by physician, for history of COVID, for vaccination status. Per guidelines, U07.1 is used only for confirmed cases of COVID-19. Question 9. Which code is used for candidal vulvovaginitis? B37.0, B37.3, B37.4, B37.7. B37.3 is the code for candidiasis of vulva and vagina. Question 10. The term MRSA stands for mild respiratory syndrome A, methicillin-resistant Staphylococcus aureus, multiple resistant surface antigen, modern resistant staph alpha. MRSA is a common antibiotic-resistant infection coded in Chapter 1. Question 11. What is the code for shingles, herpes zoster, without complication? B02.9, B01.9, B00.9, A60.9. B02.9 is for zoster without complication. Question 12. A patient has infectious mononucleosis. The code is in the range of A00, A09, B25, B34, B15, B19, A15, A19. B27 is the code for infectious mononucleosis. Question 13. Which code is used for primary syphilis? A50.0, A51.0, A52.0, A53.0. A51.0 is the code for primary genital syphilis. Question 14. The code for sepsis due to methicillin-resistant Staphylococcus aureus is A41.02, A41.01, A 41.9, A 41.51. A 41.02 specifically identifies sepsis due to MRSA. Question 15. How do you code sepsis with acute organ dysfunction? Code A 41.9 only. Code A 41.9 and a code from subcategory R 65.2. Code R 65.2 only. Code the infection only. Severe sepsis requires the underlying infection code plus R 65.2-. Question 16. Which of the following is an example of a Z code related to infectious diseases? Z11.1, screening for respiratory TB. A 15.0, B20. A 41.9. Z codes are used for factors influencing health status, such as screening. Question 17. The code for West Nile virus with encephalitis is a 92.31, a 92.30, a 92.32, a 92.39. A 92.31 is the specific code for West Nile virus with encephalitis. Question 18. For gastroenteritis due to rotavirus, the code is a 08.0, a 09, a 04.9, a 00.0. A 08.0 is the code for rotaviral entrythes. Question 19. Which code is used for asymptomatic HIV infection status? B20, Z21, O98.7, R75. Z21 is used when the patient is HIV positive but has no symptoms. Question 20. A patient is treated for an unspecified viral infection. The code is B34.9, A99, B99.9, B34.8. B34.9 is viral infection, unspecified site.